You are watching AYV Television.
From our broadcasting house here on Wesley Street in Sierra Leone's capital, Freetown, this is Primetime News on AYV TV and radio. You're watching us on channel 33 and listening to us on frequency modulation 11.7. I am Edima Conte. Let's start with tonight's headlines. 4 accused persons appeared before Justice Makeba over the alleged marriage of a 17-year-old girl. As Sierra Leone grapples with limited access to information and accountability within the extractive industries, the Sierra Leone Extractive Industry Transparency Initiative signs MOU with the Audit Service Sierra Leone. And data from the Sierra Leone Psychiatric Hospital reveals 52% of all substance abuse cases related to young people at the age of 20 to 29. First in the news. The drug known as kush has become the most visible symbol in Sierra Leone. The scale is now measurable. Data from the Sierra Leone Psychiatric Hospital January to September 2025 shows that 52% of all substance abuse cases involve young people aged 20 to 29. Within that, 27% are aged 20 to 24 and 25% are between 25 and 29. Now, health professionals warn that this is the country's most economically active generation, now disproportionately affected. Globally, the United Nations Office on Drugs and Crime estimates that over 296 million people used drugs in 2021 alone. Against this backdrop, stakeholders have gathered in Freetown to mark the International Day Against Drug Abuse and Illicit Trafficking under the theme Vigilance from Everyone in the Fight Against Drug Trafficking and Drug Abuse. AYV's Isa Bangora reports.
For many households, addiction is no longer a distant issue. It is present in living rooms, schoolyards, and streets. Health workers describe a pattern of rapid dependency. Families describe loss of direction, disrupted education, and emotional collapse. What begins as experimentation often ends in long-term harm. The psychiatric hospital data underscores the urgency. More than half of recorded cases involve people in their 20s. They warn that without intervention, the country risks losing a significant portion of its productive workforce to addiction and untreated mental health conditions. At the New Brookfields Hotel in Freetown, government officials, civil society actors, development partners and private sector representatives gathered to confront the growing crisis. Africa Global Logistics Limited also participated, reaffirming support for presenting efforts and youth protection initiatives.
Today we are here not just to celebrate Anti-Drug Day, International Days Against the Drug. No. We are not here only to celebrate something. Today we are here to show our support for all victims and to tell them that we are not with them, we are with victims, but not with this traffic and drug dealers. We are strongly against them.
Speakers described the drug trafficking and abuse as a shared threat requiring coordinated action across all sectors. The message from the conference hall was consistent that no single institution can address the crisis alone. Communities, schools, religious leaders, and the private sector were all called up to strengthen vigilance and early intervention.
While the world has made significant progress in combating drug menace, illicit drug production, trafficking, abuse, and the emergence of new psychoactive substances continue to threaten public health, national security, sustainable development, and the criminal networks are becoming more sophisticated. Exploiting technology, vulnerable populations, and weak community structures to expand their illicit activities. In the face of these evolving challenges, our responses must be united, innovative, and unwavering.
Speakers stressed that awareness alone is no longer sufficient. Provision, rehabilitation, and enforcement must work together. They warned that kush is not only changing behavior, but also eroding social stability in vulnerable communities. The call was for a national response grounded in urgency, coordination, and sustained commitment. As Sierra Leone observes this International Day, stakeholders say the country stands at a critical crossroads. One path leads to deeper crises. The other demands vigilance, compassion, and action. Issa Bangura, AWV News, Freetown.
Well, still on the International Day Against Drug Abuse and Illicit Trafficking, across the world, drugs are leaving a trail of broken lives and fractured communities. Behind every statistic is a family carrying a burden that numbers alone cannot describe. Sierra Leone is confronting that reality with growing urgency. Kush has become the face of the country's drug crisis, as Issa Bangura reported earlier. Well, against this sobering backdrop, the National Drug Law Enforcement Agency, in partnership with the Ministry of Internal Affairs, has joined the international community to commemorate the United Nations International Day Against Drug Abuse and Illicit Trafficking. Here is the report. Drug addiction rarely destroys a life overnight. It begins quietly. Then, like a slow-moving tide, it erodes families, consumes dreams, and leaves entire communities searching for answers. Across Sierra Leone, kush has become the most visible symbol of that crisis. Hospitals are treating increasing numbers of young people with severe mental health complications linked to substance abuse. Communities are witnessing rising crime, school dropouts, unemployment, and homelessness among those trapped by addiction. The executive director of the National Drug Law Enforcement Agency says drug abuse is no longer simply a public health concern. It has become a national security, economic, and social development challenge that demands a united response from government, communities, parents, schools, and young people themselves.
Societies have been confronted by threats that undermine human progress and weaken the foundations upon which prosperity and stability are built. Today, among those challenges is the growing menace of illicit drugs and substance abuse, a menace that destroys lives, fractures families, fuels criminality, undermines productivity, and robs nations of the energy, creativity, and promise of their young people. It is therefore fitting that we gather here not merely to celebrate, commemorate an international observance, but to reaffirm our shared commitment as nations. A commitment to prevention over indifference. A commitment to rehabilitation over abandonment. A commitment to partnership over isolation. And a commitment to ensuring that the future of our beloved Sierra Leone is not surrendered to the destructive forces of drug abuse and illicit trafficking.
The crisis extends far beyond the individual. The World Health Organization recognizes substance use disorders as chronic but treatable health conditions. Yet globally, only a small portion of those affected receive adequate treatment. In Sierra Leone, health authorities acknowledge that expanding rehabilitation services, mental health care, and community support remains an urgent priority. The Ministry of Health says it is strengthening programs aimed at ensuring people living with addiction receive treatment, counseling, and opportunities for recovering instead of stigma alone.
And in Ministry of Health, we continue to be committed to addressing drug and substance abuse through a coordinated and evidence-based approach. Very key word. Under the leadership of Excellency the President, retired Brigadier Dr. Julius Madablu, the Presidential Task Force on Drug and Substance Abuse was established to coordinate action through 5 pillars, as Mr. Bawa has already detailed here and other speakers. And we, the Ministry of Health, we lead on the care and treatment pillar, while providing technical support across all other pillars. As lead of the care and treatment pillar, our ministry has expanded treatment and rehabilitation services, strengthened mental health and addiction services at the Sierra Leone Psychiatric Teaching Hospital and other facilities, integrated substance abuse into primary healthcare facilities, which is one of the key areas that we are really homing on. We have trained healthcare workers and improved referral systems to support recovery.
The observance served not only as a commemoration, but as a moment of reflection. Speakers warned that law enforcement alone cannot win this battle. Prevention must begin in homes, schools must become places of awareness, communities must replace silence with support, and rehabilitation must offer hope where addiction has sown despair. Because every young person rescued from addiction is more than a life saved. It is a family restored, a future reclaimed, and a nation made stronger. The fight against illicit drugs continues, but stakeholders say lasting victory will depend not only on stronger laws, but on stronger communities united against a common threat. D. Maconte, AYV News, Freetown. Well, away from drugs, let's now move to governance in the extractive industry. As Sierra Leone still struggles with limited access to information and accountability within the extractive industries, there is already an intention to generate over $300 million in annual government revenue, driven by the critical mineral strategy from 2026 to 2031, according to the country's Mines Mineral Ministry. This sector is expected to boost economic generation, accounting for over $1.3 billion in annual export values. Hence, as Sierra Leone still crawls with limited access to information and accountability within the extractive industries, the Sierra Leone Extractive Industry Transparency Initiative had initiated a memorandum of understanding with the Audit Service Sierra Leone to enforce accountability and transparency with the industry. To find out more on how this works, our governance reporter Emmanuel Nyake Momo has the story.
In 2026, Sierra Leone's extractive industry aims at generating over $300 million in annual government revenue, driven by Critical Minerals Strategy 2026 to 2031. The mining sector significantly boosts economic generation, accounting for $1.3 billion in annual export values and approximately 11% of total government revenues, according to the Calabash media. Now, the Network Movement for Justice and Development via their website 2025 affirmed that the mining sector, while contributing significantly to economic growth, often faces criticisms related to its contribution to environmental degradation, human rights abuses, and inadequate community benefits. By conducting social audit, stakeholders can identify and rectify shortcomings, promptly ensuring that the positive impact of mining operations aligns with the needs of the local communities. Hence, Sierra Leone Extractive Industry Transparency Initiative had signed a memorandum of understanding with the Audit Service Sierra Leone. But how would this MOU ensure transparency and accountability within the country's extractive industry?
So the disclosure itself helps to improve on the transparency aspect, because there is a perception that things are happening in the sector, no one knows about it. But with SLETI and the data that we provide, it gives you everything you need to know. How many mining licenses that were issued, how many contracts were signed, what is the revenue from the sector, what contribution the sector is making to the economy. So all of that becomes available to the citizens. So the citizens can then use that information to make informed decisions, to hold their representatives accountable, or to hold governments accountable, or to hold companies accountable. So we also publish employment data disaggregated by sex. We want to know how many women are employed in the sector, but not only number of women, but in what capacity, in what are they in senior management position, or are they just casual workers, or are they laborers? So all of those are information that we put together in that report that we publish that helps to improve transparency and accountability in the sector.
There is already a community development fund. Mining companies are expected to disburse 1% contribution of revenue into this fund. How would this memorandum of understanding between the Sierra Leone Extractive Industries Transparency Initiative and the Audit Service Sierra Leone promote accountability, ensuring that funds paid by mining companies into the Community Development Fund are utilized judiciously by the Community Development Committee?
Yeah, I want to see the impact of those ones. So yesterday, I think in our management meeting, they came out clearly. So this year, AG has that in plan, and that's something that we have to follow through. Because we need to see, because mining cannot be taking place within the country and then people still to complain the same. Because those revenues, when they come, what you add value to it is how does it impact the lives and livelihood of the community and the people that still within those communities.
So how will you work with Slaty, for example, in that direction?
So Slaty will be in partnership. So Slaty, they are like custodians of data relating to mining. And how do? They do request for those information and then they keep them, they oversee it and ensure that all players are in compliance with the EITI international standards. These are regulations that guides the extractive sector.
What we have not been able to do yet, which we will now start to do, is the utilization of that fund. Because the mining companies, on their part, they pay their 1% to the Community Development Fund, which is managed by this Community Development Committee for implementation of projects at community levels. But what we are now beginning to do at EITI, because previously we just reported how much the mining companies have paid and how much has been received by the committee. But now we want to now start reporting on the utilization itself. So if, for example, the mining company have already paid 6 million into the committee fund, how much of that 6 million has been utilized and on what? You know, so we're going to start reporting on that as well, because there is so much misunderstanding with regards to the utilization of that fund.
But how does the Audit Service Sierra Leone audit the extractive industry? Does their mandates fall within the extractive industry?
So the composition of the mining sector, how the players are in Sierra Leone is threefold. One, there's a government composition. That's why the secretariat is being established. And you have government players like the Ministry of Mines, the Ministry of Fisheries, because they are in this, the Ministry of Agriculture, they are in the extractive sector, although we have not started operating in those areas yet. But you have NMA, you have NRA, you have the EPA. These are all in players in the extractive, and these are government institutions. So, and also you have the civil, the non-state actors. They too are also representative in there, and then you have the companies themselves, the mining companies themselves. So now, two of those sectors falls outside the mandate of the Auditor General. That is the civil society or non-state actors that are represented on them. They call it the MSG. That is the multi-stakeholder group. They are like a board managing the affairs of the extractive sector in Sierra Leone. So they fall within their, two of those sectors fall outside the mandate, the direct mandate of the Auditor General. That is the mandate of auditing all public institutions. So, but the others, like the NRA, the NMA, they all fall within the mandate of the Auditor General. Now, within the Audit Service Sierra Leone of itself, we have a unit, a standby unit, just in for the extractive sector. We call it the Extractive Industry Sector Group.
Some extractive industry experts believe that publishing reports on mining revenues contracts, digital mining cadastral administration system, publication of a real-time data on licenses, public understanding of natural resource management, value addition are succinct roadmaps to apt development within the extractive industry. Emmanuel Nyakemomo, AYV News, Freetown.
Well, still on governance, across the world, governments are grappling with a difficult question. How do they fairly reward those who keep the public service running? Well, the International Labour Organization says equitable pay is fundamental to productivity, accountability, and social justice. Yet, in many developing countries, wage disparities continue to fuel low morale and weaken public institutions. Well, in Sierra Leone, the challenge is equally stark. Although the national minimum wage was increased to 1,200 leones in April this year, many public servants with similar qualifications still earn markedly different salaries and allowances depending on the institution they serve. Seeking to address those long-standing disparities, the Wages and Compensation Commission has taken its international consultation to Kenema, engaging public workers on a new vision for fair and sustainable remuneration. Our regional correspondent Sam Alfalahai reports from Kenema.
For many public servants, the monthly pay slip tells two different stories. One speaks of dignity, the other of disappointment. Across Sierra Leone, workers performing comparable duties often receive unequal salaries, allowances, and benefits. It is a disparity that has lingered for decades, quietly eroding morale and confidence within the public sector. The Wages and Compensation Commission, established under the Wages and Compensation Commission Act of 2023, was created to confront the imbalance.
Today, you can have a policeman with a first degree, a military man with a first degree, somebody who decides to be a teacher with a first degree. You can have somebody with a first degree working with a commission or a parastatal. The question is, because they all have fun and they are they all having the same salary? And that is the complication of the job that has been given to us to harmonize.
Sierra Leone's public sector employs tens of thousands of workers whose performance directly shapes education, healthcare, agriculture, security, and public administration. Officials say reforming compensation is therefore not simply about wages. It is about improving service delivery for every citizen. The Commission says its works includes reviving salary structures, conducting job evaluations, regulating allowances and pensions, resolving pay disputes, and advising government on suitable compensation policies.
If the Wages and Compensation Commission is established, one, to determine the wages, and two, to harmonize, the issue of determination that has been responsible for the distortions in the public service, most of them are legal at some point.
The engagement in Kenema also gave workers an opportunity to ask difficult questions. Discussions centered on collective bargaining, wage administration, and the future of public sector compensation. For many participants, it was the first opportunity to engage directly with the institution tasked with correcting long-standing inequalities.
As a woman, we don't work for 36 years, and they still get 2,000, enough. May they cry to this commission. May they come into this situation, make them solve problems so that everything will be smooth. Because people really are agreeing from may they be inside the classroom.
Fair compensation is more than an economic policy. It is a measure of justice, and in a public service where commitment is often tested by financial hardship, many hope this conversation will become the beginning of lasting reform, not another unfinished promise. Samal Falai, AOV News, Kenema, Eastern Sierra Leone.
In another story, child marriage steals childhood. It's called short education, deepens poverty, and exposes girls to violence, early pregnancy, and lifelong health risks. Well, according to UNICEF, more than 640 million women and girls alive today were married before their 18th birthday, while around 12 million girls are still married each year. In Sierra Leone, despite decades of advocacy, the practice has remained deeply rooted. Human Rights Watch estimates that nearly 3 in every 10 girls are married before the age of 18, with the numbers even higher in some rural communities. Last year, Parliament passed the Prohibition of Child Marriage Act 2024, criminalizing child marriage in every circumstance and making Sierra Leone one of the few African countries with one of the continent's strongest legal protection for children. Hence, 4 men appeared before Justice Magiba over the alleged marriage of a 17-year-old girl. AYV's court correspondent Ibrahim Ramadan was in court and filed sources report.
Courtroom 1 of the High Court was unusually quiet. At the center of proceedings was not simply a criminal case, but a test of Sierra Leone's resolve to protect its children. Before Justice Magiba stood Sayo Mara, Lansana Kura, Saliu Kamara, and Abubakar Kamara, each facing charges under the Prohibition of Child Marriage Act 2024. The case concerns the alleged marriage of a 17-year-old girl, identified as AK, whose identity is protected by law. Prosecutors allege that on the 17th June 2026, at Grafton Village in the Western Rural District, the first accused, Sayomara, contracted a marriage with the child, contrary to Section 2 of the Child Marriage Act 2024. He pleaded not guilty. The court also had that Saliu Kamara, identified as the girl's father, allegedly consented to the marriage in breach of the Section 3 of the Child Marriage Act 2024, which he pleaded guilty. The remaining accused, Lansen Akura and Abubakar Kamara, are charged with aiding and abetting the Child Marriage Act under Section 10 of the Act, which both pleaded guilty. Justice Mageba noted that none of the accused was represented by legal counsel, although they intend to find a lawyer, as asked by the judge. The judge ordered that all 4 accused to be remanded in custody, pending further proceedings. The matter has been adjourned to the 2nd of July 2026, when the defendants are expected to appear with their legal representation. For child rights advocates, this case reaches far beyond one family. It signals the beginning of judicial enforcement of a law designed to protect thousands of Sierra Leonean girls from forced and early marriage. Whether it becomes a turning point will depend not only on legislation, but on consistent enforcement, community awareness, and the courage to challenge tradition that places children at risk. Ibrahim Ramadan Jallo, AYV News, High Court, Freetown.
The World Health Organization estimates that nearly 260,000 women died in 2023 from largely preventable maternal causes. Almost 95% of those deaths occurred in low and lower middle income countries, with sub-Saharan Africa carrying the greatest burden. Now, in Sierra Leone, the statistics of maternity is improving, but not to where it should be. According to the latest estimates from the United Nations, the country records approximately 443 maternal deaths for every 100,000 live births. That means 1 in every 36 Sierra Leonean women faces a lifetime risk of dying from pregnancy or childbirth-related causes. Against that backdrop, Maristop Sierra Leone has opened the Lamina Sanko Center in Freetown, marking 4 decades of providing sexual and reproductive health care. The new facility is expected to expand access to life-saving maternal health services for women, girls, and families. AOIB's Zero Jalo tells us more.
For 40 years, Maristop Sierra Leone stood where life begins. The organization now operates health centers, mobile outreach teams, and community-based services across Sierra Leone. Government officials, development partners, healthcare professionals, and invited guests gathered in Freetown to witness the opening of the Lamina Sanko Center. The occasion also marked 40 years of Maristop Sierra Leone's presence in the country. It was both a celebration of progress and a reminder of work still ahead.
Maristop actually was established in 1986. That's when we really have our first, center. And now, 2026 marks us our 40th year. Actually, is in August that will be a 40th year, but we'll actually start to celebrate the milestone of that. So we have seen where we have come from a single staff, a single center, and just one outreach team. But so far, we are actually in all of the 16 districts in this country, and we have, our team, out there, like the channels that we are operating on. So like, by then we know the maternal mortality that is in the country. We can see about 1,682 per, 100,000 baht. Now we are talking about, 354. It shows the leadership of the Ministry of Health, that have really, tried to see how to make sure we combat that.
The World Health Organization said that access to skilled birth attendants quality antenatal care, emergency obstetric services, and voluntary family planning remains among the most effective ways to prevent maternal deaths. In Sierra Leone, significant progress has made over the past 2 decades, yet the country continues to record one of the highest maternal mortality ratio globally, underscoring the need for sustained investment in healthcare systems and reproductive health services.
For 40 years, you have been a trusted partner in advancing sexual and reproductive health right across our country. Through your clinics, outreach programs, community engagement, youth-friendly services, family planning initiative, and internal health intervention, your organization has helped thousands, if not millions of women, men, adolescents, and families access quality healthcare services. And indeed, you have been very much complementary to what we are doing at the Ministry of Health, that 360 holistic response to healthcare delivery.
The Lamina Sanko Center brings several essential services together under one roof, from family planning, general medical consultations. Health officials believe integrated care will improve access while reducing delays that too often cost lives. For millions of women, that journey into motherhood remains perilous. The opening of the Lamina Sanko Center cannot erase every barrier, but it offers something every health system strives to provide. Not merely another building, but another mother returning home to hold her child. Yero Jalo, AYV News Freetown.
This is Primetime News on AYV Television and Radio. Stay tuned for more stories after the break.
I run a small logistics company. Every cent counts. I didn't think I needed a fuel card until I got the Cornex fuel card. Now, I track exactly how much fuel my fleet uses, in real time. And when my wife or kids need fuel, no cash, no stress. It's safe, accepted nationwide, and I control how much goes on each card. At the end of the month, I see the savings, real savings. Cornex fuel card. I didn't know I needed it. Now, I can't run my business or family without it. Fuel smart. Live smart. Visit any Cornex filling station to sign off, or any Cornex office to get your card.
Welcome back. I am Edima Conte and this is AYV's Primetime News. Thank you for joining us tonight. Let's take more stories. Malaria remains one of the most pressing public health challenges across Africa, with Sierra Leone among the hardest hit, where it continues to be the leading cause of illness and death. In a boost to the country's response effort, a new malaria monitoring machine has been handed over to Sierra Leone's National Malaria Control Program to strengthen surveillance and improve early detection in the fight against the disease. Let's have the report from Ibrahim Ramadan Jallo.
Malaria remains one of the most common diseases affecting African countries, carrying a devastating and disproportionate health and economic burden. The continent accounts for approximately 95% of all global malaria cases and deaths, making it a global epicenter of the disease. Beyond its health impact, malaria continues to act as a heavy economic drag. It costs African countries billions of dollars annually in direct medical expenses and indirect losses due to reduced productivity and widespread absenteeism from work and school. In Sierra Leone, malaria remains a severe and persistent public health crisis, standing as the country's leading cause of illness and death.
Our traditional monitoring ways, as we all know, In a traditional way, we monitoring the mosquito is use our body. So the machine will release the human body to sit in the real environment seat and to monitoring the mosquito beside. So also it can recognize the species and the number and the gender. So it can put some alert and risk is out in the cloud platform after we sit the risk rulers after we sit it. Through the risk result, we can know where's the mosquitoes. Sorry. Okay. The mosquitoes is high, so it can help us to control the mosquito better and exactly.
In a significant development aimed at strengthening the fight against the disease, the Chinese Center for Disease Control and Prevention has officially handed over a mosquito monitoring machine manufactured to Sierra Leone's National Malaria Control Program Office. The equipment is expected to enhance surveillance, improve data collection, and support early detection efforts in malaria control across the country.
Diversification in understanding whether other mosquitoes that cause other diseases are here. So therefore, we should embrace it as a country. My message to the general population, the device that you see there, and I don't know if the media can point to that device. When I first saw it, I was thinking it's something that you use a dispenser for water, but it is not. It is really not a dispenser. It is not for children to play with it, so if by adventure they place it in your area, it is not for you to go and open and know what is there.
Health experts say the donation marks an important step in improving disease monitoring capacity and strengthening collaboration in public health response systems as the fight continues. For AYV News, Ibrahim Ramadanjalo reported.
The World Health Organization estimates that more than 1.19 million people die in road crashes every year globally. Africa bears the heaviest burden. Despite accounting for only a small share of the world's vehicles, the continent records the highest road traffic fatality rate globally. In 2021 alone, an estimated 225,000 people lost their lives on African roads. In Sierra Leone, road safety remains an urgent concern. The World Health Organization estimates the country's road traffic mortality rate at 13.8 deaths per 100,000 people. However, authorities in Koinadogo district are preparing to launch a new traffic enforcement operation aimed at restoring discipline on the roads and preventing avoidable tragedies. Our correspondent Ibrahim Sudaisko reports from Kavala.
The meeting room at the Kabbalah Divisional Headquarters was filled with concerns not about politics or economics, but about human life that can be lost in a moment of recklessness. Police officers, transport operators, and traffic wardens gathered around a shared concern. Particular attention was directed at commercial drivers and motorcycle riders. The local unit commander of the Kabbalah Police Division, Assistant Commissioner of Police, EDC Van de warned that traffic regulations still carry on, not to punish road users, but to protect them.
This bike they overload them with school picking them, small picking them. I don't always say this. I say if we say we attack them this long, they left for wrong tea, then go for home. Then pick it and even gets injured, then also police don't divide. But we need to do something about this. As a district, as a division, we need to do something. Let we call parents, let we talk to we parents then. Let them stop. Not so hard up. Not risk you picking in life because you feel say they save small money. You take them picking and then you overload them. For one great bike, you go up to 5.
Across Africa, the World Health Organization says poor compliance with traffic laws remains one of the leading causes of road deaths. Overloading, dangerous overtaking, fail to wear helmets, and disregard for road signs continue to claim thousands of lives each year. Chief Inspector Agnes Fefegola, the District Traffic Officer, and Sector Commander Saidu Kamara stressed that enforcement alone is not enough. Public cooperation is equally important.
The license office don't dey now Koenadugu, Kabala Town. So because of that, we dey urge them for make they try for do everything possible for let them license the vehicle, let them license the motorbikes there.
This is the appropriate moment we therefore go out on operations way for make people comply on either the traffic rules and regulations and also the issue of licensing the vehicles and motorcycles, as well as acquiring driving license for.
Representatives of the commercial bike riders and drivers union welcome the initiative. They acknowledge that discipline on the road is a shared responsibility, and they pledge the support for efforts aimed at protecting both passengers and motorists.
First, the next year no been there. For long time, she don't get common understanding, mutual understanding between yourself. From there, we go work on what you want to agree upon. First, you no been there. If you see the government here, if it's the bike riders union and the drivers union and the police and the road safety, we work in the same body. First, you don't get that common understanding. Because any time we come understanding all day, peace no go dey.
The message from Kabbalah is clear: road crash are not acts of fake. Many are preventable, and every life saved begins with a choice of slow down, a choice of obey the law, a choice of remember that the journey matters, but arriving safely matter more. Ibrahim Sudais Kuruma, AYV News, Kabbalah, Northern Province.
But now for sport. The British High Commission has organized a send-off party in honor of Sierra Leone athletes traveling to represent the nation at the 2026 Commonwealth Games in Glasgow. Marie Esther Samura has more.
Sierra Leone's delegation to the 2026 Commonwealth Games in Glasgow was honored with a send-off reception hosted by the British High Commission. The event brought together athletes, officials, and stakeholders to celebrate this milestone. During the reception, the president of the National Olympic Committee, Prince Swale, talked about the importance of Sierra Leone's participation at the Games and highlighted the various disciplines in which the nation will compete.
We're so proud of the team that we have assembled. I can tell you just briefly how we've been preparing, All these athletes belong to different disciplines, not all of them are bunched in the one discipline. So we have boxers, and we have athletes that are judo athletes, we have swimmers, and unfortunately we also have athletes that are not based in the country, but will be taking part in the Commonwealth Games, come July. We're still working through, we haven't gotten to the final delegation size yet because there's still the procedure is still working its way through. We have visas that we need to take care of. We're having a few challenges, something that we will take up with the High Commission probably in private.
A panel discussion followed featuring athletes who spoke about the crucial role of inclusivity, focusing on the participation of persons with disabilities and the representation of women in sport. They said they've prepared well as they go into the games.
The first people that are wanting to feel proud are the Sierra Leoneans. Every Sierra Leonean, whether home or abroad, I know with this opportunity I will make you proud. I will make Mama Sabo proud. And these young disabled athletes that are going to the field very early in the morning with no food in their stomach, keeping everything, knowing that the future holds a lot for them. I am there to make you proud and build that hope in you. I want to say thank you to the NOC and the NSC for the privilege that they give up to us by selecting not about familiarity, it's about performance, the selection. And I want to say with this, I will come with the medal for Sierra Leone.
Of people with disability, we are not known. People don't know about us. We are not considered. So with the help of God and my president, if I'm opportune to travel, I want to make them proud.
The government has expressed its satisfaction with preparations so far. The Minister of Sport encouraged the athletes to remain dedicated and to remember that they have the nation's confidence as they aim to deliver strong performances for Sierra Leone.
Going to Glasgow, I want to leave you with 3 Ds. The first one is dedication, and that has brought you here. The second one is diligence, and that has made you the best. And the last one is what you continue to do until you leave this domain, and that is dedication. You always have to show passion for what you believe in, and the sky will be your limits. The purpose of going to Glasgow is not by mistake. We fall within the Commonwealth family, and that is why we feel so comfortable here today. We are in our house, you know, and there's no way we can be left out.
As the official start of the Games approaches on July 23, 2026, Sierra Leone's athletes will continue their intensive training in the coming days. Maria Samura, AYV Sports, Freetown.
But that's all for Primetime News tonight. For more stories, visit our website at www.ayvnews.com. If you have any comment on the news, please send us an email to info@ayvnews.com. I am Edima Conte. Many thanks for watching and listening. Good night.